Good afternoon, my name is Zahir Abbas. I'm one of the clinicians working here in the emergency department. Can I please confirm your full name and date of birth, please, sir?
My name is Nabil Sandeed. I was born on July 5th, 2004.
Wonderful. Nabil or Mr. Sandeed, what's your preference?
Nabil should be fine.
Thank you, Nabil. And how old are you now?
I'm 19 years old.
Wonderful. Nabil, my name is Zahir, like I said, nice to meet you.
Nice to meet you.
I've been asked by the consultants to perform a respiratory examination on you today. Now, there are a few components to the, but for the most part of it, it'll essentially entail me having a look, listen and feel of your chest. Would that be okay with you?
Yeah, should be fine.
Now, in order to actually do the examination, I will need you to remove the upper garment, for which reason I'll have the examiners act as a chaperone. Would that be okay?
Yeah. Okay.
Wonderful. Are you in any pain or discomfort?
No, not at the moment.
Lovely. So I'll just give the stethoscope a quick clean, and while I do that, if you would be kind enough just to remove the upper garment. Is that okay?
Lovely.
Thank you. Thank you, Nabil. Are you warm enough? Are you comfortable?
Yeah, it's okay.
If you want me to stop any time, at any point, don't hesitate, just say, and we'll go from there. Okay. Now, so I'll start with the endobed examination. So here, I'm looking for any clinical paraphernalia, looking for any oxygen cylinders, any gas, any venturi mask, any nasal cannula, looking for any medications that may be associated with respiratory disorder, such as your inhalers, Montelukast, butin pot. And then I'll have to look at the patient themselves. Nabil looks to be breathing fairly comfortably without the use of any accessory breathing muscles. His respiratory rate is in and around 12 to 14 reps per minute of normal depth. There's no obvious chest deformities, pectus excavatum, pectus carinatum, and there appears to be no evidence of surgical scars from the frontoma here. Okay, Nabil, I'm now just going to ask you to bring your hands out, just rest them on your thigh if you will, please. Okay. So starting with the hands, I'm actually going to start with the pulse altogether. Just look straight ahead, relax for me completely. So I'll check the pulse. I'm measuring for 15 seconds. Wonderful. So this is a normal pulse, measuring about 76 beats per minute, and his respirator measured for 30 seconds multiplied by 2, and that was 14 breaths per minute. Nabil, I'm just going to now have a look at your hands. There's no evidence of tar staining, there's no evidence of peripheral cyanosis. Can I just ask you to bring your hands together like so for me, please? Okay. That's perfect. Okay, Shamrock's window is present, no evidence of clipping, and just bring your arms out like so for me, please, if you will. And there's no evidence of fine tremor, otherwise known as salbutamol tremor, and just cock the wrist back for me, if you will, please. And again, there appears to be no evidence of asterixis, which might indicate hypercapnia or otherwise liver pathology. That's wonderful. Thank you. Bring your arms back down if you will, please. I'm now going to have a look at Nabil's face. Can I just ask you to remove the glass, please? May I take them for you? Yes, please. I'm going to ask you to bring the eyelids down and just look up to the ceiling for me, please, Nabil. And relax. Thank you very much. And open your mouth and lift up your tongue to the roof. And that's wonderful. Thank you. So the conjunctival palpebral were well pallid, and there was no evidence of central cyanosis in the sublingual region. That's your glasses back. Thank you very much. Thank you. Okay, Nabil, what I'm now going to do is I'm now going to actually feel your heartbeat, if that's okay. I know it's respiratory, but this is part of the examination. I'm going to place my hand on the front of your chest. Is that okay with you? Yes. Lovely. If it's uncomfortable at any point, just do say. Again, just look straight ahead if you will, please. Okay. So I'm feeling for the apex beat. So we've got the suprasternal notch moving inferiorly. The most prominent region is your manubrosternal angle, i.e. the angle of Louis. Drop laterally, and that's the second rib inferior to that second intercostal space. Third rib, third intercostal space. Fourth rib, fourth intercostal space. Fifth rib, fifth intercostal space. Move laterally to the left midclavicular line. I can't feel Nabil's apex beats. Nabil, can I just ask you to lean over to the front of that way? And it's palpable. Thank you very much. The apex beat is not displaced. Nabil, I'm now going to actually feel on the front of your neck. This is for the windpipe itself. Maybe a little uncomfortable. Again, if it's too much, please do say. Is that okay with you? Yeah. Lovely. Again, just look straight ahead if you will, please. So suprasternal region for the jugular notch. Placing my hands on the medial aspect of the clavicle, where the head of the medial head of each sternocleidomastoid is, and you've got the just on the anterior aspect. Yep, trachea is well and truly in line, and assessing either side of the trachea. No deviation. I'm going to push on the trachea, big deep breath in if you will, please, and breathe out as normal. And there's no tracheal tug, which might indicate the likes of emphysema. Now, what I'm now going to do is I'm going to place my hands on the base of your chest, just at the bottom over here, just to see how well it expands. Is that okay with you? Yeah. If I might ask you just to bring your hands on your hips for me, like so, for me, please. That's good. And And okay, in your own time, big deep breath if you will, please. And back out. And do that once more for me, please. And back out. Lovely. Thank you. That's good bilateral equal chest expansion. Nabil, I'm now going to tap on the front of your chest. Is that okay? Again, just sit nice and relaxed. You can relax your arms if you like. So I'm going to tap directly onto the clavicle first. And then. Wonderful. Good normal resonance. The percussion sounds. There was no hypo or hyper resonance. Okay, Nabil, I'm now going to, beg your pardon, just bring your hands onto your hips as well for me, please. Don't forget to do the auxiliary regions. Okay, thank you, Nabil. I'm now going to have a listen to your chest. Is that okay? Good stuff. So the stethoscope might be a little bit cold. I do apologise. Okay. So the first one in the apices of the lungs, just where the supraclavicular region is, we use the bell. And breathe as normal, okay? Every time I place my stethoscope on, big deep breath in that form, please. In your own time, just nice and relaxed. Good. Hands on your hips again if you feel, please, Nabil. You okay?
Yeah.
Good, not hyperventilating. Lovely. Thank you, Nabil. What I now want to do, relax your arms again. I'm going to ask you to turn around so that I can assess your back. For the sake of the video, I'm going to do the back of the examination really facing this way. Normally I'd get you to swing over that way, and then I'm going to actually swing you the other way so that the video can see the actual lymph nodes as I do those. Would that be okay? So slight derangement in the whole thing, but for the sake of the video, is that okay?
Yeah.
So if you swing over that way. Good stuff. Okay. So again, observation here, there's no obvious deformity, kyphoscoliosis, scoliosis. There is evidence of a surgical scar over here, but there's no acute unwellness here. Okay, so Nabil, what I'm going to do is I'm just going to get you to take a big deep breath in when you're ready again, please. And back out. Lovely, thank you. Okay, just cross your arms in front of you, if you will, please. That's good. I'm going to tap down the back of your chest. Is that okay?
Yeah.
Lovely, thank you. And I'm going to listen to the back of your chest if I might. Again, the step might be cold. And again, big deep breath in your own time when you're ready. Thank you, Nabil. That's that. And I'm going to now just get you to relax your arms and just swing over that away if you don't mind, please. That's wonderful. So Nabil, what I'm now going to do is I'm going to assess the lymph nodes, just the glands all around the base of your chin and your neck. Is that okay?
Yes.
Again, any discomfort or anything, I want you to stop. Is that okay?
Okay.
Lovely. So starting on the submental, submandibular, pre-auricular, post-auricular, into the suboccipital, the anterior cervical chain, the posterior cervical chain, and the supraclavicular. Wonderful. And Nabil, you can swing yourself back over this way if you will.
Okay.
Couple of things I just want to do now. One thing is I want to assess your GVP. So in essence, I'm just going to get you to lay back at 45 degrees and just look over that shoulder there for me, please. I'm going to shine a light over the front, okay? Looking for JVP distension, so normally the JVP, and that's wonderful, thank you, it's not distended. The JVP should be 3 to 4 centimeters above the angle of Lubbe, what we measured here. A distension of the JVP may well indicate the likes of core pulmonale as well as other pathologies. In the absence of seeing the JVP here, I could elicit the hepatojugular reflux, but I don't think that's warranted in the given situation. The final thing I'll do here is, again, end of bed, I'll assess Nabil's lower extremities, assessing for pitting edema. Once again, I'll press and hold firmly over the medial malleoli for best part of 5 to 10 seconds, and then once I remove that, I can just run my fingers over the surface of the skin to identify whether or not pitting edema is present. Nabil, that marks the end of the examination. Thank you very much for your time. I'm just going to sanitize my hands again. You may now get dressed. Do you have any questions for me?
No. Okay.
Thank you very much. I'll now present the findings to the examiners and the camera. Is that okay?
Yes.
Lovely. So this, so as for the S-bar, so this was, the situation was a respiratory examination in Nabil, a 19-year-old male. The background is such that there's no past-medical history or comorbidities that I was advised of. In terms of assessment, this was an unremarkable respiratory examination whereby the pulse rate was 76 beats per minute, normal character, good volume. His respiratory rate was 14 rests per minute of normal depth. Chest expansion was bilateral and equal, and auscultation. There was good vesicular breathing with good air entry, and I could propose some vocal pharyngitis, but again, I don't think that was necessary here. In terms of recommendations, I would suggest from here performing a full set of observations to calculate the new score, which will include his blood pressure. I could recommend spirometry testing and or lung function testing, a peak flow meter perhaps, and if it's absolutely necessary, then even maybe a chest x-ray. Thank you very much.